Our mission statement is to make sure that families, as they go home with their babies, have a healthy start and can thrive.
The newborn home visiting program is overseen by Healthy Start of North Central Florida. It's a collaboration between the hospitals, childbirth providers, and our social service agencies in the community. The Children's Trust of Alachua County funds the newborn home visiting program to improve the health, safety, and future for all babies born in the county.
In the hospital, after you had your baby, our family partner will visit you in your room while you're recovering on the mother-baby unit. She'll explain more about the program and how we can help you. She will also enroll you at that time. Another way you might want to enroll is by calling us or going onto our website, newbornhomevisiting.org. You can even enroll prenatally and include some of the topics or information that you might want to cover while we do our home visits.
The newborn home visiting program is available to all Alachua County families who give birth in the county. They can give birth at the hospital, a birthing center, or at home. After baby is born, a registered nurse visits the family at home for free to see how they're doing, share information, and connect them to local resources.
Additionally, you can have your provider or your doctor refer you to our program as well.
If you give birth at North Florida, we have a family partner that will see mom once you give birth. And then if you give birth at Shands, I'm at Shands. I'm the family partner that will see mom and talk to her and get her enrolled as well. The enrollment process is easy. It only takes a couple of minutes. When we're in the room, we talk to mom. We know mom just had a baby, so obviously she's probably overwhelmed, has a lot going on. We just briefly tell her what the program is about, what the services we offer, and we gather information. It's very limited, basic information to get mom enrolled. And after that, she's done and she gets contacted when she gets home.
Pregnancy and childbirth can be very challenging, both emotionally, physically, and mentally, and we're here to be an extra support system for those families. The only requirement to be enrolled in the newborn home visiting program is to live within Alachua County. There's no other income requirements. As a program, we are absolutely there to meet families where they are with no judgment and open arms to make sure that they have what they need. There is no need too little or too great for them to present to our program.
Car seats expire. So that was something I did learn new. They ended up helping me get another car seat because mine that I did have was expired. The confidence of knowing that I can reach out to someone if I had any questions, because of the relationship we build, it was easy to talk to her if I had any type of question. So I will recommend it to friends, people I don't know, because it's a great program to get involved in.
We have nurses that come to the home to see mom and baby. They do a physical assessment on both mom and baby to make sure they're doing okay. And then we also check on their mental health, make sure mom is doing all right after delivery. The nurse goes over a ton of different things, a home safety checklist to make sure the home is safe for baby. And then afterwards, we do some case management follow-up so we can help connect mom with resources in Alachua County. If she needs lactation support, if she needs mental health counseling, our job is to connect mom with that.
All of the nurses in the newborn home visiting program have extensive expertise and experience in working with moms and newborns. I love being a newborn nurse home visitor because I'm able to provide families with education on topics such as breastfeeding, safe sleep, tummy time, how to soothe and take care of a newborn. I can provide guidance and answer questions and concerns that the parents may have. And during the home visit, I will do an assessment on both the mom and the baby to ensure positive long-term outcomes for the family. I also enjoy the opportunity to provide families with education on proper car seat installation, infant CPR, choking prevention, and home safety.
We got home from the hospital, feeding wasn't going well. Kara came over and helped with feeding. If it weren't for her, I don't know what would have happened. We probably would have ended up back in the hospital. It was easy. She was easy to talk to. She was friendly. She answered all of my questions and more. It was a wonderful experience.
If a parent doesn't want me to come to their home, I've asked people if they'd like to meet me in a library, and we can do that if they're more comfortable with that. I can do a telehealth appointment where we just talk on the phone. I let parents know that I'm there as an advocate for them also. I make sure that they have their appointments. I make sure that baby's being seen. You still have to take your baby to the pediatrician.
We also provide, if mom is in need of, let's say, enrolling in WIC, we can provide her with information to get her started with that. If she needs help obtaining, let's say, clothes or supplies for baby, there's organizations that can help with that. Food, Medicaid, there's a ton of resources in the community we can make sure to get mom connected to. We also have ongoing home visiting support. With our program, she gets a one-time visit from the nurse, but once that visit is over, if mom still wants someone to come in and continue doing parenting education with her and things of that nature, we can refer her to other home visiting programs such as Healthy Start, Healthy Families, McV, things like that.
We can also help families who need a car seat and don't have one, as well as help families who need a safe place for their infant to sleep. The registered nurse can also share information with the family about other community resources and programs such as the Dolly Parton Imagination Library, Saving Smiles Dental Clinic at UF, and of course our free infant CPR and choking prevention class that we have every other month. We encourage all providers, obstetricians and pediatricians to refer their patients to our program. The program is free to all families in Alachua County with a newborn, including parents that are fostering as well as adopting children.
If you would like to find out more information about the Newborn Home Visiting Program, you can go to our website at newbornhomevisiting.org.
I will tell everyone about it. Everybody that I know that's having a baby, I would recommend it to them.